Welcome to MedEd Bytes, micro just-in-time education. Today's MedEd Byte will cover why adjusting the SonarMed FiO2 setting is important and how and when to make those adjustments. The FiO2 reading on the monitor is important. It needs to match the ventilator setting because the SonarMed system sends sound waves from the endotracheal tube down to the lungs and measures the echoes that return. The density of the air within the airway can affect the speed the echoes travel and therefore the readings on the monitor. Since oxygen is a denser gas than room air, as the FiO2 is increased, it will change the density of the gas in the airway and the speed the echoes travel. By adjusting the FiO2 to match the ventilator setting, the accuracy of the monitor is maintained. There are only 4 category settings of FiO2 on the monitor: 21 to 40%, 41 to 60%, 61 to 80%, and 81 to 100%. Whenever a decision is made to change the ventilator's sustained FiO2 setting, the SonarMed's monitor FiO2 should be changed as well. Temporary settings, sometimes referred to as a bump, do not require the monitor FiO2 setting to be adjusted if it is a short duration. It is good practice whenever coming on shift or after a temporary bump in FiO2 to check to see that the monitor's FiO2 setting matches the ventilator FiO2 setting. There are 2 ways to adjust the FiO2 in the monitor. Using the main menu. Press the function key to the right of the gear icon and enter the main menu screen. The main menu will appear. Highlight the sound speed correction heading using the up and down arrows on the directional keypad. Press the center button of the directional keypad to enter the sound speed correction screen to adjust your FiO2. Use the downward directional keypad arrow to highlight the O2 percentage on the middle row. Press the center button on the directional keypad to turn the yellow reading to white to adjust. Adjust to the appropriate setting for the ventilator FiO2 by using the up-down arrows on the directional keypad. Press the functional key to the right of the return arrow to leave the screen. The monitor will ask you to confirm and accept the changes. Once accepted, the monitor will return to the main menu. Verify the correct FiO2 is displayed at the top of the screen. By pressing the function key to the right of the return arrow, you will go back to the main screen. The second way to adjust FiO2 is to use the waveform screen function. To access the waveform screen, press the function key to the right of the waveform icon as seen above, where the arrow is pointing. The waveform screen will appear. By pressing the right or left arrows on the directional keypad, highlight the O2 reading in the upper section of the screen. Press the center button on the directional keypad. After pressing the center button, the O2 adjustment screen appears. Press the downward directional key to highlight the O2 percentage selection in the middle row. Press the center key on the directional keypad to highlight the FiO2 readings from yellow to white so an adjustment can be made. Use the up and down arrows to select the appropriate O2 setting. Press the function key to the right of the return arrow. The monitor will ask if you want to accept the changes. Press the function key to the right of the green check mark if yes, or the red X if further changes are needed. This will return the monitor to the waveform screen. Medtronic, engineering the extraordinary.